Good morning, ladies and gentlemen. Thank you for the invitation to the conference. My name is Landa, Krzysztof in Polish, if you please. And I'm the president of the Ukrainian Society of Evidence-Based Healthcare. I used to be Deputy Minister of Health in Poland in years 2015-2017. And I'm the founder of Watch Healthcare Foundation in Poland. My presentation will be about public health, so key principles of public health in Poland. I used to study at the School of Public Health at Collegium Medicum of the Jagiellonian University, but through my professional lifetime, I played various roles in public health management in Poland at the National Center for Quality Assessment in Healthcare, at the Central Office of National Health Fund, but also as the Deputy Minister of Health, as I mentioned before. Let's start from definition. So actually, that definition applies to utilitarian approach. So this is like value for money from the perspective of the whole society. Public health is the science and art of preventing disease, prolonging life, and promoting health through organized efforts of society, organizations, public and private, communities, and individuals. It encompasses a wide range of activities aimed at protecting and improving the health of populations rather than focusing on individual patients. Anyway, in the society, all individuals matter, but in total, we would like to take care of the whole society from the perspective of public health. Key principles, just to set the scene and just to find the proper area where we are going to elaborate on. So equity, assuring access to health services for all. I know that in Poland, but the same in Ukraine, your Minister of Health is supposed to take care of equal access to all health services financed from public sources. All those services financed and co-financed from the public sources, they are called koszyk, basic benefits package. Then obviously prevention, so focus on disease prevention and health promotion. Community participation involving communities in health decisions, so we would like to have participation of patients, especially in the focus of value-based healthcare, where patients are being put in the center of the system and their values are the most important ones. Then evidence-based approach, so we would like to design, then to run, then to use evidence for decisions in health policies. With respect to Poland, as I suppose to focus on Poland, we certainly have some priorities. And strategic goals are as stated here, so improve health outcomes, reducing morbidity and mortality rates, certainly enhance health education. This is a great debate right now in Poland, currently voluntary topic at the schools, which refers to health and supposed to improve public health in Poland to promote better, more healthy lifestyles. Strengthening health systems, this is actually our problem. The greatest problem in Poland is actually access to health services, which is supposed to be guaranteed. So the services are theoretically guaranteed in Poland, so we should have fine and immediate access to these services, which are financed from public sources. But this is not the case. Poland has a great number and growing number of waiting lists. And unfortunately, waiting times also expand So efficiency of our health system needs to be improved. Obviously, we also would like to address health inequalities. So Minister of Health has spotted vulnerable populations and certainly takes care of them. Currently, we are also discussing a new large amendment of the law on reimbursement, drug reimbursement, where we are, for the first time, we are going to introduce egalitarian approach to the first technologies of proven efficacy in ultra-rare indications, so mostly orphan medicinal products. Major public health programs in Poland. This is obviously national health program, very comprehensive health strategy for the whole population. Program for prevention and control of infectious diseases. Obviously, even more important after the COVID outbreak. Program for mental health promotion. So we do care of mentally in people, but also we would like to prevent mental diseases. Currently, another debate is about children at school which use mobile phones, smartphones too much, and we would like to limit their time in front of the screens, as really children got in troubles if they use mobile phones or smartphones too much. Then health promotion in schools. As I said, health education is already there, and we are going to expand that topic. Probably it's going to be obligatory subject at schools soon. Obviously, there are also other strategic documents and strategies which could be discussed. And what I do encourage Ukrainians to do is to develop such strategic documents, and then so the Minister of Health and NSZU could work together in order to implement these successful policies. What are the most important instruments for managing the healthcare system at the disposal of the Minister of Health? Because while we have these strategies, you have to implement them, and not everybody is aware what instruments, what tools do Minister of Health has at hand in order to implement these policies. So certainly the most important tool of the Minister of Health in any country, it is the content of the guaranteed benefits package. So if something is included, if any technology, drug, medical device, procedure is actually included to basic benefits package, to koszyk, then it is being widely used. Access is usually good, and actually utilization of these drugs or medical devices is broad. While if Minister of Health refuses reimbursement, so refuses inclusion of a particular technology to koszyk, then I'm sorry, but it's not widely used, and people don't have access to these interventions in a given medical indication. Another tool is actually pricing or tariffication. The question is what methods we are going to use. Do we use micro-costing method, supply-demand method, or maybe other? And I know that currently you discuss these issues at Dzierżawny Ekspercki Center. So I'm pretty sure that soon you are going to be much more efficient in pricing and tariffication methods. Then methods of financing service providers, including focus on moral hazard. So moral hazard is actually different behavior of the insureds while they have possess health insurance, or their behavior is quite different if people don't have health insurance policy. So taking that moral hazard into account, we should promote certain methods of financing health service providers. Certainly, if you have high moral hazard, then you shouldn't use fee-for-service method. Obviously, Minister of Health has at hand all instruments of quality, so quality management, quality assurance, quality management, and these tools, among them, we may list registries, quality indicators, practice guidelines and practice standards, certification of various kinds, accreditation of hospitals, etc. This is a very broad topic, so certainly I don't have, I cannot cover that within 15 minutes. So networks, you have networks of hospitals. Maybe you should also think about networks of wards. What we actually discuss at the moment in Poland, this is a wide approach in networking in scopes. So this is care which is based on organizational standards and practice standards, just like breast cancer unit, plus geographical and demographic criteria for spreading the network according to the health needs of the society. Then obviously this is very important, especially for Ukraine, to make proper and transparent decisions on investments. I do believe that Ukraine after the war will need to invest a lot of money in infrastructure, both in new infrastructure, but also in renewables. In Poland, we have Jowisz, which is in actually Polish expression of Jupiter. This is called Instrument Oceny Wniosków Inwestycyjnych w Sektorze Zdrowia, which is actually MCDA, Multiple Criteria Decision Analysis Tool. And I do encourage you to develop similar tool in Ukraine, as if you are going to have a rational and transparent investment system and decision-making on investments in healthcare, then you are going to have a lot of money from abroad as well. But if you are not going to be transparent and rational, then you are going to get only a little. Now, obviously, there is even greater need than in Poland for complementary health insurance. Additional insurance develops in Poland in a way of supplementary health insurance, which cover such technologies which are included to basic benefits package in Poland. But because we have waiting times, substantial waiting times to these services, then supplementary health insurance develops. While I do encourage you to pay attention and focus on complementary health insurance, so all those technologies which remain out of scope of basic benefit package, i.e. koszyk. Then key public health institutions in Poland, this is National Institute of Public Health, Central Institution for Research and Data Analysis, very useful for the Minister of Health. Then provincial health authorities in voivodeships, we have everywhere, we have departments for health and public health. So they deal regionally with all public health issues. And then local health centers, Centra Zdrowia Publicznego, they provide services and community outreach. Challenges of public health in Poland, then we have aging population. So this is currently the most difficult topic for public health in Poland. Therefore, we think also about complementary health insurance and nursing insurance. It is possible to improve access for elderly to better care, better custody. Then lifestyle diseases, and you should know that we focus on sin taxes. So currently we have tax on sweet beverages. which make children fat. So we tax them heavy, and then consumption of sugar along with these beverages decreases. But also we tax smoking, regular cigarettes, as well as other nicotine products. I think that you should recognize continuum of risk. So the less harm, less tax. The highest prices for regular cigarettes, which are the most toxic, then less for heated tobacco products, then less for e-cigarettes, and the smallest taxes and smallest prices for nicotine pouches. Also, we tax alcohol and all beverages containing alcohol. Access to services, as I say, we have growing times and growing number of curious. Therefore, this is one of the greatest challenges in Poland, and public awareness, so need for better health literacy. Thank you very much. It was a pleasure talking to you. I certainly wish all the best to Ukraine. Sława Ukrainie, Gerojom Sława, and let's stay together. As together we have strength, and we can do much better than separate. Thank you very much again, and goodbye.